Okay, so now you've done the November 2013 paper, you can have a go at another one. The next paper is the February 2014 exam. So what I want you to do this time, just like last time, print off a copy of the exam paper and we'll work through each question step by step, going through the answers, where you may have made errors, and allow you to score the whole paper to get another idea of how you may perform on the big day. You'll see from looking at this paper that it's exactly the same in terms of layout as the November 2013 paper. So again, it's out of 80 marks. This is the new style paper, which is how your exam will look on the day. There's 14 questions again on question 1. So let's give it a go. I want you to press pause in a minute and then work through the answers and then we'll go through them together. Okay, so let's go through your answers. There's 14 in total, remember, so give yourself a mark for each question that you get right. I'm just going to have to use my sheet to go through. So question 1, which was peri, is around. Then you've got sclero, which is hardening. Bi, which means two. Poly, meaning many. Ortho, which is straight. You may have put bone here, but bone would be an answer for osteo. So a good way to remember this is to think that orthodontist is the specialist in the straightening of teeth. So ortho means straight. Next, we've got two very commonly confused words as we found from the November 13 paper. So AmSpa do like to put them on a lot, as we'll see here. We've got gastro, meaning stomach, and laparo, which is abdomen. Then we have maringo, which is eardrum, myelo, which is bone marrow or spinal cord, not to be confused with myo, which is muscle, nato, meaning birth, latero, which is sideways, dynia, pain, phasia, which is speech, not to be confused with plasia, which is formation, or phagia, which is swallowing. And finally, we have oid, which is resembling. So like I say, give yourself a mark out of 14 and we'll move on to question 2. So now it's on to question 2. Remember, this is a really big scoring section with 28 marks up for grabs, which makes up about a third of the overall marks for the entire paper. So really worth concentrating on this section and having a stab at it, even if you don't fully know what to put for your answer. So here you're being asked to define medical words. Like I say, if you only know part of it, put any part that you recognise, give it a go and we'll go through the answers in a second. So the answers are as follows. Prostatectomy, removal of the prostate gland. Now remember, AmSpa want you to define words when you've used an answer that has also appeared in the question. So here you would need to say removal of the prostate gland and then in brackets the male sex gland, just to define prostate. Venous is concerning the veins. Endometriosis is condition of the lining of the womb spreading to other organs. The ulna is the lower inner arm bone, not to be confused with the radius, which is the lower outer arm bone. I had a physio that I worked with years ago that said a good way of remembering it is to think that ulna sounds like all near. So it's the bone, if you can see, that is near to your body, the inner bone. It sounds like all near, ulna. Next word, arteriosclerosis, is the condition of hardening of an artery. So remember, you need to say condition because it ends in osis, and I'd probably advise to say something about artery in brackets after the question, a type of vessel or something, as artery has appeared in the question as well. Edema is an accumulation of fluid in the tissues causing a swelling. Chondroma is a tumour in the cartilage. Nephritis, inflammation of the kidney. Dyspnea, difficulty breathing. Myalgia is muscle pain. Encephalitis is inflammation of the brain. Remember that cephalo is head and en is within. So enkepha, anything, is within the head, and within the head is your brain. So encephalitis is inflammation of the brain. Osteomalacia is softening of the bone. Tracheopathy is disease of the trachea. You'd also have to define trachea, so in brackets, after your answer you need to say windpipe. And colporrhaphy is repair of the vagina. So add that up out of 28 marks, giving yourself just 1 mark if you got half the answer or 2 marks if you got the full answer, and we'll move on to question 3. So the best thing for me to do for this section is for me to just read out where there are gaps and where there are numbers on your answer sheet. So for question 4A, you should have the following: 5, 4, 2, blank, blank, 3, 1, blank. For question 4B, you should have 5, 1, blank, blank, 2, blank, 3, 4. Each correct answer is worth a point, so there were 10 marks up for grabs in total. So now we're on to question 5, where you need to provide the medical word for the 8 definitions that they've given you on the paper. Again, each question is worth 2 marks, so have a go and we'll go through the answers. So let's go through the answers. Question 1, inflammation of the liver is hepatitis. Question 2, cutting into the kidney is nephrotomy, Nephrotomy. Surgical removal of the womb is a hysterectomy. Concerning the gullet is esophageal. So you have to have the AL bit at the part, not just esophagus, as they've asked you for concerning. And note that the spelling is OESOPHAGEAL. The membrane covering the lungs is the pleura, or the pleural membrane, which is PLEURA, or pleural. Nosebleed is epistaxis, which is EPISTAXIS. Disease of the spleen is splenopathy. Notice that there's only one E now in spleen. Spleen becomes splen for splenopathy. And then crushing of a stone is lithotripsy. So all of those are worth 2 marks and give yourself a score out of 16. Question 5B is the question where you have to define 6 medical specialities. Remember the difference in the word endings. If you see anything ending in ology compared to ix, how you need to distinguish the difference here. And each question here is worth 1 mark. So not massive points up for grabs, but they should be easy to score marks in the exam, provided you learn all the specialities. So let's go through your answers. Bearing in mind, a lot of the answers that we're going to give are quite wordy. So AMSPA will just be looking for you to have the gist of the answer. So long as what you've put resembles roughly what we're saying, it doesn't matter if it's not word for word. So let's start with physiotherapy, which is the speciality relating to physical means of treatment, for example, massage or exercise. Paediatrics is the medical speciality concerning children's diseases. So notice we've said medical speciality because it ends in ix. Urology is the study of, because it ends in ology, the urinary system. Geriatrics is the medical speciality concerning diseases in the elderly. Rheumatology is the study of diseases of connective tissue. And immunology is the study of the body's immune system. Here you'd also have to say the body's defence system, as immune appears in the question immunology. So give yourself a mark out of 6 points, and then we're on to the final section. So I don't really need to introduce this section too much. You've got 6 drug abbreviations here, and you just need to give the definition for them all. So hopefully now you should have your answers. So starting from the top, we've got NSAID, which is non-steroidal anti-inflammatory drug. Then we've got MIMS, which is Monthly Index of Medical Specialities. BP, which is British Pharmacopoeia. So the spelling of pharmacopoeia should be PHARMACOPOEIA. Some people may have put blood pressure here, which is right in a sense because BP is a medical abbreviation for blood pressure, but remember this whole section is asking you about drug abbreviations only. So if you put blood pressure here, AMSPA just wouldn't give you an answer, a mark. Moving down to MCG, which is microgram, not milligram, as that would be mg. Then we have TDS, which is 3 times a day, and QDS, which is 4 times a day. All these are worth 1 mark each, so a total of 6 marks. You've now finished the paper, so you can add up the whole of your paper and give yourself a score out of 80. So just to give some meaning to your score, to get a pass on the exam, you have to score 70% or higher, which is a score of 56 out of 80. So if you scored 56 or more, you've passed the paper and well done. If you've scored 64 or more out of 80, then that puts you in the merit bracket where you have to have scored 80% or higher on the paper. And if you've done really, really well and scored 90% or above, which is a mark of 72 out of 80 or higher, then you'll have scored a distinction. So a big well done to you if you're one of these people. Okay, so time to crack on with some more past papers. I hope this has been helpful to you and good luck with the exam.